All right, I am going to go ahead and get us started. My name is Dr. Leah Jeanette. I am from Case Western Reserve University, and I am one of the folks today that's going to be speaking to you about the Master's in Bioethics and Medical Humanities, focusing on bioethics and public health ethics. Thanks to everyone who is in attendance. We're so glad you could join us. A couple of just housekeeping things I want to talk about first. We have our agenda, so we're going to talk about Case Western Reserve University School of Medicine. We'll talk about our program and specifically public health ethics and the work that we're doing and that students can engage in. We'll talk about student assistantships and financial aid, the application process and deadlines. We'll talk about Cleveland, where we are located, and then we'll do Q&A at the end. How to submit Q&A. So there is a Q&A feature here on Zoom that you can submit your questions to. We will see them as they come through, so you can submit them at any point, and we will be able to get to them either as we do our presentation or at the end as well. I want to introduce our other hosts today. We have Dr. Aaron Goldenberg. He is Vice Chair and Associate Professor of Bioethics and the Director of Research in the Department of Bioethics here at Case Western Reserve University. That's myself in the middle, Dr. Leah Jeanette. I'm the Assistant Director of Education and a Senior Research Associate in the Department of Bioethics. And we have Sam Hamilton, who's the Assistant Director of Enrollment Management for the School of Medicine. I'm going to let Aaron introduce himself a little bit more as we go into talking about Case a little bit. So Aaron, I'm going to turn it over to you. You can introduce yourself a little bit more, and then we can talk about Case.
Sure. It's really great to be on with all of you, and looking forward to hearing your questions and talking to you a little bit. As Dr. Jeanette said, I am the Vice Chair and Director of Research for the Department of Bioethics at Case Western, but I've also been part of the Case Western bioethics community for a very long time. I actually did the master's program, this very master's program that you're learning about today, in 1999. So I was in one of the first classes. We're now in our, almost about to start our 26th year of our master's program. So really proud of that. And then I left for a few years. I got my master's in public health at the University of Michigan and worked for a little while. And then I came back in 2004 and did my PhD here in the department. Finished my PhD, did some research for a while, and then joined the faculty in 2009 and have been on faculty since then. So bioethics at Case has been a big part of my life, and it's a big part of my heart. And I'm really excited to tell you about it today and tell you a little bit about public health ethics, but also just about my work. Did you want to talk about the school?
Yes, I will. I fell for the classic Zoom. I was muted. One other thing is I wanted to let Sam give an opportunity to introduce herself as well.
Oh, of course. So I'm Sam Hamilton. I work with the enrollment management team for the School of Medicine. So bioethics and medical humanities is just one of the areas that I help to give support to. But my main role here today is to make sure it records and to answer any questions that Dr. Jeanette pings to me. So I'm just here as a helpful resource.
Thanks, Sam. So Case Western Reserve University, in particular, we are located in Cleveland, Ohio. I, like Dr. Goldenberg, might be a little biased because I am also a alum of the Master's in Bioethics program and Medical Humanities program here at Case Western. But our School of Medicine, we are very proud of this. We, and there's all different ways to rank, schools and such. But the School of Medicine at Case Western Reserve is #1 in Ohio. We are considered number 24th in the US when it comes to medical research education. Case also has a fantastic health law school. Our Masters of Nursing program, our Doctorate of Nursing programs are some of the top in the country. We also have a very high-ranked social work program through the Mandel School here at Case Western Reserve. We're very proud of the impact that our university makes, both in our students and in the fields that we teach and work. In particular, our biomedical research is very widely seen. We are ranked number 7 in a publication impact, and we're ranked number 23 in NIH research funding. Dr. Goldenberg, as the director of research, you probably could speak to this a little bit more in terms of the research grants and kind of a little bit of the NIH research funding we get.
Sure. Yeah, a lot of students come in wondering, well, what is bioethics research? What is bioethics and medical humanities research? And our department, in addition to having a number of educational programs that you're going to hear about today, we have a lot of really stellar national and international research. We're a center for excellence in LC research, which is ethical, legal, social issues in genetics and genomics. So we do a lot of research on kind of public opinion around genetics and how do we think about genetics and genomics. We have a lot of research on equity issues in medicine. So what are the ethical implications of health systems that may not be accessible to underserved or underrepresented groups? We have research on organ donation. We have research and scholarship on aging, on health in pediatrics. We have a wide range of scholarship going on in the department, including issues around stem cells and a lot of other new technologies. And so one of the things that's really special about our department is that our students can get involved in our research projects. And every year we have a lot of our students who come away not only learning about things within the context of the educational program, but also working with faculty, learning about research. And that's just something that I did as a student, and it's something that really kind of impacted my life. And so we're definitely a very educational, but also research focused department.
So I think one of the big questions that comes up when we talk about bioethics and medical humanities is, why study it? Why does it matter? What does that mean? And those questions consistently come up. And Dr. Goldenberg, you probably get this when you meet someone for the first time, is what's bioethics? So it's definitely one of those fields that is so far reaching that we don't even realize it sometimes. As you know, the healthcare industry impacts all of us, whether you are working in it or you are seeking treatment or care. And because there are constant advancements in science and technology, this can lead to a lot of big questions that really are ethical concerns at the heart. So questions like, should we intervene? And can we intervene, right? Questions like, what kind of values should inform policy and practice? That's something we're clearly seeing right now in the world of public health and public health ethics. And questions about ensuring justice and respect for persons, both in research and clinical practice, and ultimately in community health as well. So then the question, and I'm going to pose this question to Dr. Goldenberg, what is public health ethics then? In light of what we talked about with what is bioethics and why do bioethics and medical humanities matter?
Yeah, it's a great question. And I think it's one that, man, if we were a year ago, I might even answer differently than where we are now. Clearly, the pandemic has started to raise, not just started, but has been raising a number of really, really crucial ethical, legal, social questions that are hit at the kind of the core of our response to COVID. How do we distribute vaccines? Here in Ohio, we just announced that we're going to 40 and above at Friday. Well, how are those decisions made? What were the ethical considerations that went into those decisions? What happens if you have 5 patients and only 2 ventilators? How do you make decisions on distributing those ventilators? So very clearly, the kind of ethical and value challenges within medicine are being expanded and further challenged by a public health emergency. And it's not that public health ethics is new. Public health ethics has been around for a long time. But I think, at least in recent times, this is definitely an emergency, a public health incident that has brought a lot of the public health issues that we're going to talk about kind of to the surface, right? Very much on people's minds. We have a lot of our students who maybe never thought about public health ethics as an area they wanted to go in, and now are very invested in thinking about public health infrastructure, thinking about responses to pandemics, thinking about medical needs within pandemics, and what kinds of ethical issues they bring up. Not only is public health ethics not old, it actually is very old. And if you go to the next slide, I want to start with a little story, which is the story of Jon Snow. And you can hit forward, not this Jon Snow, which maybe some of you are thinking of, but this Jon Snow. This Jon Snow is also known as one of the fathers of modern epidemiology, and was a clinician and a scientist in the mid 1800s. And if you go to the next slide, there was a very large cholera outbreak in England, and really actually all around Europe in the mid 1800s. At least 10,000 people died, probably more. We just don't have as many good records as we would, do right now. And there was a very large outbreak in 1854 in an area of London called Soho. And you have to remember, at the time, we didn't really have very elaborate germ theory. We didn't really know what made people sick. We were just on the precipice, just on the cusp of better understanding molecular and germ theory at the time. There was still a general belief that miasmas, or something we called bad air, caused sickness. So if you breathed in bad air, you would get sick. Jon Snow didn't quite think that this added up, because he started to create what were some of the first epidemiological maps, looking at where people were getting sick, where people were dying from. And if you actually go to the next slide, you can actually see one of his original maps. And it's a little hard to see, but you can kind of look, there's these little like squares, and that shows number of people who are sick within particular buildings, right, within the area of Soho. And what Dr. Snow did, which was really novel at the time, is he started to look at patterns, and he noticed that people were getting sick. That the areas where there was more sickness were people who were drawing their water from a particular water source. In this case, as you can see here in front of you, the Broad Street pump, right? The pump was one of a number of areas where people got water from. And he tracked where the water came into the Broad Street pump and realized that that particular pump drew its water from downstream in the Thames, where the Thames River, where sewage was collecting and other nastiness was collecting, and that people were drawing their water and then getting sick at a higher rate. And he looked at other pumps in the area and noticed that, people weren't getting sick, and he tracked those water sources, and those water sources were from higher in the Thames, where the water was cleaner and fresher. And so he deduced, using this information, that it was the water source that was causing illness. And it was really groundbreaking. It was really novel. Now, no one knows if this really happened, but the story goes, and I like the story goes that he went to the Broad Street pump and had the handle removed, so that no one could actually access water from the Broad Street pump, and had to go to other sources in neighborhoods to draw their water. And that was one of the things that turned the tide against the cholera outbreak. Now, whether that happened or not, it's a little bit unclear. Whether or not, he just put out warnings. There was some evidence that the pandemic was kind of going down at the time anyway. But it's a wonderful story about public health and why epidemiology and public health is so important in outbreaks. And we're seeing that around the country as we think about tracing disease, all over. So again, you might be asking, well, what does this have to do with ethics? And what I want to say is that kind of epidemiology, that kind of public health work raises a number of ethical issues. So what if the residents of Soho didn't like the idea that their information was collected? Maybe didn't like the idea that someone was going to come around and count how many people died in that building, how many people were sick in that building. They didn't like the fact that their information was being used without maybe their permission. What if the government in London restricted people's movements? What would the ethical issues be for placing Soho in quarantine, for example? What if, and maybe this raises an interesting ethical question. Should the government have restricted movements in and out of Soho, which might have also helped to control the outbreak? And then there's the equity questions. There's always kind of, for me, I think it's really important in bioethics to always be asking equity questions. You know, in Soho, they directed people to other water sources as a mitigation technique. But what if there were residents who didn't have access to the other water sources, or were too sick to get to those other water sources, didn't have money to pay for people to bring them fresh water, right? So this raises this great quote from Callahan and Jennings, two very well-known bioethicists, which says, public health raises a number of moral problems that extend beyond our earlier boundaries of bioethics and require their own form of ethical analysis. And that's, for me, what's, I don't know, what draws me to public health ethics is it, I think, pushes us to think beyond just the doctor-patient relationship, or just beyond our relationship with a healthcare team, and think about our community, think about our neighborhood, think about our relationship with each other. If you go to the next slide, and we are living a live case study. And I think it's always important to recognize the people who've lost their lives due to COVID, the people who have had severe illness due to COVID. Whenever we talk about COVID, I think it's really, really important to take a second and just recognize that while we're thinking of this academically, this is happening to real lives and real people, and we have to respect and think about the real impact. But if we think about public health ethics, COVID is really is a live case study. We were seeing a number of ethical issues in public health coming up. So one is infringements on individual freedom. When we think about public health, sometimes to mitigate disease, we take away people's individual choices. So back, if we think about seatbelt laws, for example, or we think about fluoridation of water. In COVID, we're seeing this in mask mandates in private spaces where you can't go shopping, for example, if you don't have a mask. Mandatory reporting. Right? If you were to tomorrow get diagnosed with COVID, you don't get a choice of whether or not your information is given to your health department. That is a mandatory reporting scenario. And that does infringe on individual freedoms for the benefit of the community. And that's an essential piece of public health ethics. The role and the power of government in protecting health, right? So we have travel restrictions, we have mask mandates. What are the kind of appropriate and maybe the limits of the government in making policies that are meant to protect public health? And what are the ethical issues in doing so? Resource allocation, right? A huge question. How do we distribute limited ventilators? How do we distribute vaccines? How do we do so in a way that's equitable? How do we do so in a way that recognizes vulnerability in our community? All of these things are really core questions in public health ethics. And then finally, again, and I talked about this before a little bit, but there are lots of health equity and justice questions. We know that health disparities communities that are lower income and have other kinds of access issues, have higher rates of severe infection, are higher rates of death, and in part because of a lack of access to care. And so we need to always be thinking about the justice and equity considerations around kind of public health technologies, public health programs, and it's essential to think about that. So if these kinds of issues are interesting to you, if you think that these are important issues, then our program can provide a lot of guidance and a lot of education, a lot of programs that specifically get at many of these issues in public health, along with all the issues in medicine and health technologies and social medicine. But we are one of the programs that really does kind of hit at a lot of these core public health issues. You can go to the next slide. So, this raises this interesting question, which is, well, how would a bioethics and medical humanities degree help me on my career path? And I think there's a number of different ways to answer this. And we're going to draw in some of those public health principles into this conversation. But I want to make sure that we kind of cover just generally, because some of you may be particularly interested in public health, but some of you may be more interested in general bioethics or medical humanities. But essentially, bioethics and medical humanities is an interprofessional and a multidisciplinary set of fields, set of areas, set of professions. And essentially what we do in bioethics and medical humanities is is multidisciplinary, is interdisciplinary. It's looking at health from a lot of different angles. And we therefore can help launch students into a number of careers. People who are interested in legal professions, maybe people who are interested in health law, for example, can benefit from our program. People who are interested in clinical programs, that may be med school, that may be PA programs, that may be nursing school. Increasingly, health programs are requiring their students to address ethical and social issues in what they do. Every med student that I've met has had an experience in their program where they've been asked to think about ethical issues. And our program can prepare students to better address those ethical issues in their careers. Aside from clinical and legal professions, we also see a lot of our students go into regulatory work, right? So federal and state legislatures do a lot of health policy work, and a lot of our students are very interested in health policy and interested in kind of the ethical implications of health policy and go into regulatory work. Clearly, in public health, there's a lot of increased need for people with bioethics backgrounds to go into public health and to work for health departments, who are very quickly having to deal with regulatory and policy and practice implications of the pandemic. There are people who go into arts and humanities and think about the kind of connections between health and the humanities. There are people like myself who go into bioethics and become either clinical ethicists and work within hospital systems to help clinicians and patients and other healthcare workers make really difficult choices. And there are others who become law professors, clinical professors, bioethics professors, like myself. We also have a lot of students who are undecided. We have a lot of students who are saying, well, I love health, but I'm not sure what I want to do with it. That was me. I wasn't sure if I wanted to be a doctor, but I knew I loved health. This program was ideal for me. It allowed me to explore different areas of medicine and different areas of society and the intersection between society and medicine. So we actually have a lot of students who come into the program unsure what they want to do, and then they use the program as a way to explore different areas that help them to make their choices where they want to go in their profession. And again, a lot of our students have chosen public health, just to kind of get back to my area, have chosen public health as an area that they want to go into. Next slide. So our program is a one-year program generally. It's 30 credits long. I'm going to go through some of these slides a little bit faster because I want to make sure we get to your questions. It's a 30 credit program, but we do allow for a lot of electives. You actually have 13 and a half electives that you can take. And our electives are really ranging from health policy to public health ethics to research ethics to humanities and social medicine to narrative ethics. We really have a lot of really amazing courses, reproductive ethics, genetics and ethics. So a lot of our students come to the program because they really want to explore different areas, and we give a lot of opportunities to do that. Our program has clinical ethics rotations. One of the things that's really unique about our program is our students get a chance to really get their hands into clinical ethics issues. We'll talk about that in a second. This year was a little bit different, but we're really hoping that next year we can get back into the clinic. We have opportunities to study abroad. We have what we call our short-term study abroad programs, where students can actually go and spend either spring break or 2 weeks at the end of the semester in another country learning about bioethics and medical humanities from international perspectives. We have really dedicated faculty. We have faculty who want to get to know our students and give personalized advising on the program, on people's futures. It's one of the reasons why I stayed, why I'm still in the program, is I wanted to work with the faculty. They were just so amazing. And we also have student assistantships. We have opportunities for students to work with our faculty and do different things within the department. In addition to being 25 years old in terms of our master's program, this next year will represent, so if you were to come to our program, this year is our 20th anniversary as a department. Before that, we were a center. So we're really excited to have a kind of a celebratory year celebrating our 20 years of department status. And so we'll have a lot of events and really interesting and fun activities to kind of celebrate that anniversary. Next slide. So what if you were interested in public health? I'll just do this slide really quickly because I know some of you are specifically interested in that. We have a lot of opportunities. So first of all, we have a lot of courses in particular with a particular focus on public health ethics. We have an Introduction to Public Health Ethics course that I've taught before. We've also had other specialists teach that class. It's a really amazing kind of wide-ranging course thinking about all sorts of issues in public health ethics. This year, we introduced a course specifically on the pandemic and the intersection between pandemics, medical humanities, bioethics. That was a really amazing course. It was a course that was taught over a week, kind of an intensive course where you were meeting kind of 9 to 5 every day, doing really immersive work. We do have a study abroad program that I've taught, that other people have taught, that looks at public health ethics from international standpoints. I taught one in the Netherlands. And then our capstone projects, a lot of our students will choose to do public health ethics as a capstone project. We're going to talk about capstones in a second. There are research opportunities to do work in public health ethics. We also have a dual degree. So we have a number of students who come to CASE, not just to study bioethics, but to study public health. And we'll do our dual degree, and it's an MA in bioethics and an MPH. Usually done somewhere between 2 and 3 years. A lot of our students do it in 2.5 years. Some do it in 3, depending on what you'd want to do. It's a really amazing program. There aren't that many of them in the country that really lets you dive in and leave here with both an MPH and an MA in bioethics, and talk about a degree that would be useful for the kinds of things we're dealing with now at public health departments. I think that that's a really, growing area for public health and for bioethics. Next slide. So this is just a little bit of like a kind of a what does a year look like, for most of our students. Our Foundations of Bioethics course is one that happens really throughout the whole semester. It's a 6-credit class each semester. Sorry, throughout the whole year. And it's really your kind of foundational, it's in the name, but our kind of core bioethics course. It's split up into different topic areas. So you'll learn about pediatric ethics, reproductive ethics, research ethics, public health ethics, stem cells and genetics, aging, neuroethics. And it's really a chance for you to work with fellow students and faculty to kind of learn the kind of really the wide-ranging areas of bioethics. In each semester, students take the clinical ethics rotations, where you'd be assigned to one hospital in each semester. Again, this year was a little different. We did case studies and other kinds of things to fulfill those credits, but are hoping to get back into the clinical settings next year. As you said, we have electives that people take. So we have electives on reproductive ethics and public health ethics and genetics and ethics and narrative ethics and classes around medical humanities. We also have what we call our mini elective, and this is a chance to study something kind of unique. Faculty will teach a 1.5 mini elective on a particular topic. So we've had someone teach ethics in the digital divide. So ethics, the ethics of not being able, of certain communities not being able to access the internet and what that does to health. I'm teaching a mini elective this semester on the ethics of Star Trek. Yes, I'm a Trekkie, but it's interesting to look at bioethics through, in this case, a science fiction lens. And then finally, we have our capstone, which is a chance for you to kind of explore an area that you have an interest in. And we'll talk about that, I think, in a slide or two. You want to go to the next slide?
Aaron, I just want to add one thing. You talked about in Foundations of Bioethics, how we cover different topics and different themes. In talking about one of the themes we cover is public health ethics. And I find, not only are we teaching it, but like you said earlier, we're literally living the example and the case study. And so I know last year when you were doing one of your public health ethics talks, you were using COVID as an example prior to all of the stay-at-home orders and the entire world basically shutting down.
That's right. That's right. We were looking at the numbers live as things were changing, and then talking about how that changed our perspectives on things like quarantine, travel restrictions, availability of ventilators at the time. So we were kind of, as things were unfolding, using that within the context of our class. And that was, for a lot of our students, that's one of the things they love about Foundations, is that a lot of our faculty are very well connected with these national and international conversations. We have a faculty member, for example, that's very well connected in the world of stem cell ethics, and will use the time in class to talk about changes in policies around stem cells that are happening as the students are talking about these issues. And then he's bringing that to them, and then they're giving their perspectives. It's really a living and breathing class that is not just reading an old paper and kind of talking about it. It really is keeping up to kind of modern standards of bioethics and thinking about policy in that way. It's a really fantastic course. I've loved teaching in it. So students, when they come to our program, can choose to do the program as Bioethics and Medical Humanities. And any student who comes into the program and does Bioethics and Medical Humanities as the main thing that they study will get a wide range of topics, can take classes in all different areas, will learn and kind of better understand kind of core and key issues in both bioethics and medical humanities. But we do have a few concentrations for students who have a particular interest in a particular area. So the first one is medicine, society, and culture, right? These are students who are particularly interested in kind of social and humanities issues, issues around narrative and connections between health and English, and health and the arts, health and social medicine and anthropology and sociology. There are some core courses that go with that concentration. And there's a kind of a separate practicum that students can do and a monthly reading group. And it's a way for people who have particular interest in an area to kind of focus in on a particular area. Our second concentration is a research ethics concentration. So this is for students who have a particular interest in research and want to kind of really focus on the ethical implications of research. In this case, we have an ethics journal club. We have a practicum where instead of one semester of a clinical ethics rotation, you would, be matched with an IRB, an institutional review board, and look at issues related to research ethics. In both of these concentrations, the MSc concentration and the research ethics concentration, it would allow a student who has a particular interest area to kind of really dive into that particular area. But let me also just say that any student coming in, regardless of what concentration they choose, first of all, you don't have to choose a concentration. Second of all, regardless of which concentration you choose, we'll get a taste of all of these different areas. It's just our way of looking, for example, at some of the specialty areas we have. We just have some phenomenal world-renowned scholars in the area of medical humanities and social medicine. And so we decided we should have a concentration in that, give students a chance to look at that. We have a lot of expertise in research ethics. So this is a chance for students to kind of focus on those. But really across the board, students can explore all of these areas, regardless of whether or not you were to choose a concentration or not. It just gives students choice. That's really the name of the game in our program, is we want to give students an opportunity to build the program that's going to be most interesting and most useful for them, for their profession. And that's another thing that I really love about the program, is we give a lot of choices for students to kind of build what they want out of the program. Next slide. The clinical rotations is also something that draws a lot of our students to the program. We give in normal years, this year again was a little bit different. In normal years, we give students an opportunity to work in, or to observe, I should say, in different kinds of clinical settings, like the Cleveland Clinic, Metro Health, which is our county hospital, the VA health system, university hospitals, and they rotate with social workers, chaplains, genetic counselors, living donor advocates, pharmacists, music therapists, ombudsmen, doctors, specialists, and it gives students a chance to see ethics happening on the front lines of medicine. And it is an invaluable opportunity for students to really get into the clinic, see what kinds of ethical issues come up in the clinic, and then have a chance to work with faculty and clinicians to talk through those issues. We also have opportunities for students to attend an ethics committee meeting, to an institutional review board, an animal research meeting, and other different areas around medicine and around the hospitals, to give students kind of an opportunity to see ethics really firsthand. And that was something that I loved about the program. And really, I think a lot of our students come away with that being one of the favorite things that they do during the year, because they really get to see what, how kind of ethics intersects with medicine in really unique ways. And that's something that I think draws a lot of students to the program.
I would just add that, one of the, and this is going to sound funny, one of the advantages to being remote this year was that we were able to bring in speakers and talk to the students through this course. And so Normally you can't get speakers that are in California and New Jersey all in one place at the same time. It's, a lot of scheduling conflicts and those things. But because of remote, learning and the power of Zoom, we were able to bring speakers in and do presentations and hear from a whole variety of these healthcare professionals talk about what they do in the hospital, what ethical issues they face, and talk about cases that they've had come up. So it's been really great. I have joked with the students that, if you go to an intensive care unit morning rounds, sometimes you're lucky if you have a conversation with attending. Sometimes you're even lucky if you just make eye contact with them. But because of this ability to have them come speak on Zoom to our students, they got to speak to an attending for an hour and interact with them in a way that they may not have been able to. So there have been some advantages to being on Zoom and things that we're going to incorporate in the future. But of course, we want to be able to get back to the in-person rotations as much as we can.
Yeah, but you actually raise a really important point that I think is worth saying again, which is that this year has been really, really hard, but it's also given us a chance to really think, re-innovate in our program, thinking about ways to interact, as you said, with outside speakers and outside experts, ways to think about distance learning, ways to think to utilize technology in different ways. I've really, really enjoyed while I miss being in person and I miss being with the students, I've really gotten a lot out of and really enjoyed kind of thinking differently about, listening to podcasts with students and talking about them, interacting with people from, other centers. I had a colleague from University of Louisville come and talk on one of the classes. We have a colleague coming up, I think, from University of Southern California coming. So we have a lot of opportunities to kind of widen our expertise using new technologies, and that's something that I think we'll hopefully, even as we get back into to kind of regular coursework, to maintain some of those innovations. Next slide. Our capstone is, we're not a thesis program. We don't really have a thesis in our program, but we do allow students to really focus in on an area of their interest. This is a chance for you to pick a topic in bioethics and medical humanities and work with faculty who have an interest in that area. And for you to kind of demonstrate your mastery in a particular area or your interest. It's essentially a very large research paper, but it's more than that. It's a chance for you to really get to explore a bioethical issue in depth and in a way that you're working with a faculty member to look at, new issues in bioethics and medical humanities that that you find interesting, or that you find these are things that you want to explore more. We have students who are interested in for example, ethics and vaccine distribution in COVID, and so they're doing their project on that. And so it's really a great opportunity to explore a particular area that that maybe we covered a lot in class, maybe we only covered a little bit in class, and you want to explore more in depth. And that's really great. We've had students publish these in the past. They've worked with their faculty mentors to turn it into a publication. So this really is an opportunity to do something kind of unique, and we call it our capstone paper. And it really is a fun and interesting opportunity to work on a particular issue and get to know the work of a faculty member as well, which is really nice. Next slide. I'll just say very briefly something a little bit about our study abroad, and Dr. Jeanette, you might have something as well to talk about. These are short-term courses. They're 3-credit courses. So they count as an elective. They're usually somewhere between 1 and 2 weeks. We've had courses in Costa Rica, Granada, Spain, Paris, the Netherlands. We did one at Yellowstone National Park a few years ago. That was really fantastic. They're held over winter break, spring break, or sometimes in May. And it really is an opportunity to think about bioethics and medical humanities from different perspectives, from an ecological perspective in the case of the national park trip. In my case, I've been teaching a class in the Netherlands for a long time, looking at the intersection between public health ethics, drug use, and drug abuse, and issues related to public health from an international and European perspective. And so these have been really, really wonderful classes and really an opportunity to do something a little bit different. We are keeping our fingers crossed and really hoping that we can get back to these classes. Of course, we haven't been able to teach them this last year. And I think the faculty and students are really, really wanting to get back to these because they're really special opportunities. They're really unique. Dr. Jeanette, anything you want to add here?
Yeah, I would just echo kind of what you said in that they are unique opportunities. So they do function as a 3-credit-hour elective. So they seamlessly fit into the elective option for courses. And we are actively working to see if we can make these courses go. We are looking to see if Costa Rica is an option for winter break. That's the first one that would come up. And so we are trying to see what the opportunities are available, talking to our partners down in Costa Rica, and then, trying to make sure we understand what the landscape looks like in terms of the ethics of travel and the safety issues and all of that. So we are hopeful that these will launch again, and I'm sure once they do, they will be very popular for students.
I know, I can't wait to teach it again because I'm ready. I am ready.
Yeah, I'm at the point where I'll just go on any of these trips.
That's right.
Send me, it's fine.
Next slide. I mentioned the dual degree in bioethics and public health, but we actually also have a number of other dual degrees. So if you are interested in particular other intersections, we have a number of other dual degrees. We have an MD dual degree, so someone who gets accepted into our School of Medicine can do our MA program. People who get accepted into our JD program, to a law and bioethics program. We have public health, as I said, public health and bioethics. We have a new dual degree in in bioethics and genetic counseling. And that's a really unique and new, really only one of 2 programs in the country like that. We have a dual degree with our nursing program, with our social work program, our MSW program, Master's in Social Administration, and people who are interested in a PhD in genetics, we have a dual degree. In order to do these dual degree programs, you actually have to apply to both programs and indicate you're interested in doing the dual degree. You have to gain acceptance to both programs independently, and then you kind of matriculate into the dual degree. Now, that being said, we have had students that apply, for example, to the genetic counseling degree and the bioethics degree, and they don't get into genetic counseling, but get into bioethics. You still can come for bioethics. We've actually had a number of students who've done that, who said, okay, I didn't get into the other degree, but I got into bioethics and I'll come for bioethics, and then apply for that program later or apply for a different program later. But it's just a really unique way to get training in kind of these different fields and combine them with bioethics. Next slide. All right, Leah, Dr. Jeanette, I will hand this back over to you, and then please ask any questions. We'll make sure we have some time at the end for questions.
Yeah, so, one of the questions that always comes up when you're talking about graduate school is finances, right? Tuition. So we just wanted to do a quick comment on kind of what options there are. So we have something in our department very unique called student assistantships. And this provides students the opportunity to fill teaching slots, research slots, or administrative slots within our department. So for the teaching slots, it could be assisting with an undergrad course. For research, it could be joining on one project for a whole semester or a whole year, or doing several little projects throughout the year. And of course, administrative opportunities as well. And in exchange for receiving these student assistantships and doing this kind of work, you receive a partial tuition waiver. Last year, students received an average of $5,000, but it could be as much as $12,000 or more. It really is dependent on need and merit, so we look at both of those things. Student assistantships are available, like I said, to any student who's been admitted to the program. You can apply for these, and they are quite competitive. But we are very pleased to be able to offer these to our students. Of course, we have the traditional financial aid office. Students applying for aid are required to fill out FAFSA, and the financial aid office is wonderful and able to help figure out things and additional options, including grants, loans, scholarships, work study. And if you're interested in learning more about the specific of tuition and fees, you can look up that information through graduate studies. So I also talk a little bit about the application process. So in order for us to look at your application, we need to have a complete package to look at. So that includes, the general application itself, demographic information, that stuff, but also transcripts from all undergrad and grad programs, a statement of purpose. The statement of purpose is designed for us to be able to hear directly from you. Why are you interested in bioethics and medical humanities? And how does this program or studying these topics, including public health ethics, fit into your career path? Those are the two things we'd love to hear in a statement of purpose, in just 1 to 2 pages. It doesn't have to be a long statement by any means. It also requires a CV resume and then 2 letters of recommendation, including 1 faculty professor. Once an application is complete, it is reviewed by an admissions committee member, and you were also interviewed then by someone on our admissions committee via telephone or Zoom. Provided those 2 decisions line up, we would then notify you regarding your acceptance to the program. I will say we are very quick turnaround, provided that there is a complete application package. We usually can get the interview scheduled and get a decision within 2 to 3 weeks. So turnaround is pretty quick right now, which is to your advantage. And then timelines. So right now we are open for applications. Our next deadline is May 15th. This is considered our priority number 2 deadline. If you want to apply for student assistantships, you have to apply by the May 15th deadline in order to be able to submit your student assistantship application by June 1. So those dates are important to keep in mind. Our final deadline for the program is August 1st. So we do rolling admission up until August 1st. And then in late August, we have orientation and classes begin. And these dates are going to come and go before you know it. I can't believe that we are 1 year, into the pandemic and working remotely and all these things. So these dates are going to come quick. So keep those in mind. And then, there's a lot to be said for Cleveland, where we are located. I am a little biased, I will admit, because I was born and raised in Cleveland, but I did choose to come back to Cleveland. We have amazing opportunities once these things are starting to open up again. Sports are going to be allowed to have some folks in the stands, which is going to be great. So although I don't know if Cleveland Indians is even the name anymore, they're talking about changing it. But we also have our Cleveland Cavaliers. Even the Cleveland Browns were good this year. Of course, it would only happen in a pandemic year when no one can watch them play live. But there are also great art scenes. There's great music through the Cleveland Orchestra, which is highly ranked as one of the best orchestras in the entire world and across the country. We have Playhouse Square. This is kind of the theater district within Cleveland. This is the largest theater district outside of Broadway in New York City. So it is a quite extensive cultural spot within the city. It's amazing to be able to go to shows and plays and just all kinds of immersive theater experiences. Cleveland Art Museum is ranked as one of the best museums in the world, and it's free. So it's amazing walk from campus that you can go and see this amazing art museum. And Little Italy and East 4th Street are cool hot spots near campus and downtown to get to experience food and fun things that our city has to offer. So, we'll open it up to questions. If you guys have questions, please submit them through the Q&A, and we can answer these live as best as we can. All right, so I am seeing a couple questions come in. So Dr. Goldenberg, I'll go ahead and read them for you. So for the medical humanities aspect of the program, what sort of courses are offered? Are there any narrative medicine offerings?
So that's a great question. We have a couple different courses. We have, so every year our offerings are slightly different, but we have offered, I think in the last 2 to 3 years, a narrative ethics course that the students have really, really enjoyed. And I think we're gonna try to offer that again in the future. Dr. Jeanette, you can correct me if I'm wrong, but so we do have a course in narrative ethics. The other courses that we offer, we have a course, our MSc, our Foundations of MSc, which is called Foundations of Medicine, Society, and Culture, does address some issues within the context of narrative ethics, but also addresses all sorts of other issues. It's kind of similar to the Foundations of Bioethics course, but specifically looking at a wide range of medical humanities kinds of issues, including social medicine and those kinds of things. It's a great question. We also have opportunities for independent studies where if there's a particular area of narrative ethics and narrative medicine that you're interested in, we could try to build a potential program for that as well. So great question.
And, if you are specifically interested in that narrative medicine, that's also something that you can work on for your capstone. Really dive into that in a specific way, which is a great opportunity that our program offers. So another question, what are some opportunities open to those interested in gerontology within the department and master's program?
It's a great question. We actually just brought on a new faculty member in the last year. Her name is Dr. Erin Lamb. She's amazing. And she has a particular interest in the intersection between humanities, ethics, gerontology, aging. And she actually just added this semester a class in ethics, humanities, and aging. And I know that she's interested in continuing to teach that and has a lot of expertise. And so it is an area of growth in our department. It's an area that we've been thinking a lot about. What are the social issues related to kind of an aging population and what that looks like. So very much on the forefront of our minds.
So there's a question about clinical ethics rotations. Are students able to choose or at least rank what clinical ethics rotations they are interested in participating in? So I'm happy to take that question.
Yeah, I'll let you answer that one.
Yeah, so when students are thinking about their semester plans, we ask them to rank which hospital systems they're interested in, which one they prefer to go to, and then which ones meet their schedule best. But then within each hospital system, the list of rotation opportunities vary. And so each hospital has a list of opportunities. Some are required, things like going to certain ICUs or going to an ethics committee meeting are required. And then other opportunities within that hospital system are optional. So students are able to kind of customize to a certain extent what rotations they attend and when they attend them. So for instance, ethics committees typically take place once a month. In a semester, you might have 3 or 4 opportunities to attend. You pick which day you go out of those 3 or 4 dates that are offered. If you're going to a medical ICU, it might be offered every single day, including Saturdays and Sundays. You choose what day you go. So there is a give and take of some required activities and rotations, but also the ability to go back to areas and go to areas that interest you in particular. Oh, here's a great question. Do applicants with no bioethics courses in the past have a disadvantage as an applicant?
I'm happy to take that one if you want to.
Yeah, go ahead.
The big answer is no, absolutely not. We have students that come into the program with a very high level of interest. They were in the sciences and have a high interest in the ethical implications of the work that they were doing, but had never taken a bioethics course. We have students that took lots of bioethics courses. We do not require any bioethics courses as prereqs to the program. And really, we have a wide range of educational backgrounds for our students, and so it does not disadvantage you in any way to not have a bioethics course.
And I would just add, one of the things we look for in our applicants is mutual fit. So we're making sure that students have an interest in bioethics and medical humanities, and that our program and studying those areas makes sense for your career path. But also that, so it's this mutual fit, right? So it's not just that you meet, quote, the qualifications, for our program. It's not just focusing on that, but also making sure that doing our program is going to benefit your career path as well. And so, as Dr. Goldenberg said, we have students who enter our program that have not taken previous bioethics courses, and they do just fine in the program. There's a question, can you speak to the differences between the regular master's application and the IGS application for undergraduates? I'm happy to take
that one. Yeah, I'll let you take that.
I'm happy to take that. So for students who are current undergraduates at Case Western Reserve that are earning a Bachelor of Arts degree, they can apply during their senior year to do our master's program. They need to have completed their undergrad requirements, their major, their minor, electives, kind of their total credits during their first 3 years. And then during their senior year, they're able to do our master's program. The application is very similar. We're still looking for letters of recommendation, CV resume, statement of purpose. One of the things that we don't require is official transcripts, because you can submit your unofficial transcripts because you're part of the Case Western Reserve system. We can automatically go in and see those transcripts that way and verify them on the back end. There is a soft deadline of March 1st, typically for IGS applications to be submitted. In some cases, we can work with students if they miss the March 1st deadline. But that's kind of the big difference, is they're very slight. And once students are in the program, regardless if you are a traditional outside applicant for the master's program or an IGS applicant, we make no distinction. Everyone is in class together. You are treated all as grad students, and we don't make a distinction on IGS students or not. Other questions? Oh, is research a requirement as a prerequisite or during the program?
No, it is not a prerequisite, and really not even a requirement in the program. We have students who come in, aren't that interested in research, and they don't really want to, so they don't, they kind of do their own research for their papers, of course, but there's not a research like requirement. But we also have lots of students who come in and very much want to do research, and we try to accommodate that as much as possible.
We also have students who come in and they have no idea what bioethics research may or may look like. And once they get into a class, they find out that they really like an area, and they approach a professor and say, I would love to get involved in whatever you're doing. And it happens. And they find themselves working on research that they didn't even know they were interested in or had the opportunity to do.
Yep, that's right.
Any other final questions? All right, I am not seeing any more questions come in, so.
Can I pose one? I've been quiet for a while, but I have a question for both of you.
Yeah, Sam, absolutely.
So my question is why did both of you go into bioethics? What was the draw for you guys? I know that you probably have very different answers, and they probably can be very long, but just quick synopsis of why you decided to go on this path.
Yeah, I'm happy to do a very quick. So I initially intended on going to medical school, and that was kind of my career path in my mind. And I was pre-med in undergrad, and I did all of that. And I ended up stumbling into a bioethics course essentially in my undergrad. And it was that moment that like the light bulb went off in my head, and it was, the light bulb basically said, oh, this is why I like healthcare. This is why I like medicine. I don't actually like the medical details. I like the ethics of the medicine, the ethics of healthcare. And from there, I decided to do this master's program. And because of the clinical ethics rotations in particular, I became very interested in clinical ethics. And so I went on, got my PhD, and focused on clinical ethics, and spent time in the hospitals doing clinical ethics consultation and kind of working in that space. And so it was one of those things where I didn't know I was interested until suddenly that light bulb went off of like, this is why I like healthcare. So that was kind of my my entrance into the world of bioethics.
Yeah, and I'll just say really quickly, because I know we're at 5 o'clock and I want to respect everyone's time. Yeah, my story is similar. I wasn't sure what I wanted to do. I knew I loved medicine. I knew I loved science. I took a genetics class that made me start thinking a lot about the social implications of understanding one's own DNA and information, and it got me thinking. And I did an internship at Science Magazine and met some bioethicists while I was there, and they actually invited me to come to Cleveland and said, you know, if you'd be interested. And I came to Cleveland, and the rest is history. And it really was a kind of an awakening for me to kind of think about, yeah, I can do science, I can do health, but I can think about the social implications of that in a way that I hadn't really before. And that was really, really amazing. That was really great. So really, you know, really special change for me. So I encourage, if you're interested, please ask more questions of us. You know, contact us if you have any thoughts or questions. And if you're thinking about applying, I really encourage you to do so. I hope to hear from some of you in the future.
Yes, thank you so much for joining us today. You can see the email address on the screen, bioethics@case.edu. Email us if you have questions about the program, this webinar, the work we're doing, your application, whatever it might be. And we're happy to have further discussions with you. So we look forward to seeing your applications come through, and thank you so much for your time today.